Hi, I'm Keith Palanna from Health Workforce Queensland, and today we will explore what the current remote health workforce in Queensland perceive to be the major reasons health workers leave their practice or community. Before I begin, I would like to thank and acknowledge the co-authors, David Wellman and Hughes. I would like to begin by acknowledging the First Nations people as the traditional custodians of the lands on which we gather. I would also like to pay my respects to elders past, present, and emerging, and extend that respect to all First Nations people present today. I'm not going to spend too much time on this slide other than to say that Health Workforce Queensland is the rural workforce agency for the state. We are not-for-profit and are funded through the Department of Health and Aged Care. That said, I've highlighted 3 points in gold as these nuggets will provide some context as to why this work was undertaken. We have all heard of the main reasons for why staff leave, which are high staff turnover in remote and rural communities, difficulties to recruit new staff, and that these issues increase with remoteness. From the research, the reasons health practitioners leave are varied, but you can see from the 4 dot points on screen that some factors are more specific to the individual, like career progression and family concerns, while other factors are more specific to the workplace or the region, such as heavy workload and isolation. So what would help? I think it would be safe to assume that many employers or managers would love information about where they could possibly step in and help, and we thought so too. Through discussions with staff and key stakeholders, we thought it would be interesting and helpful to find out what the existing rural workforce perceptions were for reasons staff departed, making sure we covered both individual factors such as career stages or family matters, and workplace factors that reflect requirements of the workplace or community. This data was then stratified and analyzed. As a reporting requirement to the Department of Health and Aged Care, and this being a quality assurance project, we conducted online surveys that then informed our annual Health Workforce Needs Assessment for remote, rural, and regional Queensland. At the end of the survey, we include a silver bullet question that changes every year. This year, it was about why staff leave. We listed 19 individual and 19 workplace factors for participants to rate. Some factors we felt could be tied to both individuals and the workplace, so they were included in both, with slight word changes. For instance, if one nurse leaves stating lack of support, this could be viewed as an individual perception. But if 5 nurses complain about lack of support, then this would most likely be a workplace issue. Our preamble to the question was what's currently on screen, and we tried to tie it to the individual, the workplace, and even the local community. And we also highlighted the distinction between individual and workplace factors. Right, so let's have a look at the individual factors. We included factors that range from retirement to lack of perceived professional respect. Some would be extremely difficult to influence, such as retirement. Others could possibly be addressed, such as workplace support for CPD or bullying within the workplace. And others may even require intervention from the government, for example, the lack of suitable accommodation or inadequate remuneration. For workplace factors, the list covered everything from workplace culture and flexibility through to leave entitlements and available physical infrastructure. Again, you can see the variety of factors offered. As for responses, we had almost 800 participants complete at least one of the questions. Medical practitioners represented close to half of them, and there was also a good spread of participants geographically. So let's kick off with the means for individual factors for the state. To make things easier, we have color-coded ratings above 70 in purple, below 60 in gold, and the in-betweens in gray. The top 5 had means above 70 and were, for no surprises here, heavy workload and burnout was the big one, 5 points higher than the second highest, which was work-life balance. This was followed by career progression, mental health and well-being, and inadequate remuneration. You can almost see how some of the top 5 are related. Now let's see what this looks like for MM6, that is remote locations, and then MM7, very remote locations. Straight off the bat, that's a lot of purple. At the top, heavy workload and burnout crossing the 80-point mark, which consequentially affects work-life balance that came in second. Of the 13 purples with means above 70, a lot of them were around career stages and family concerns. Remote practitioners did seem to feel professionally and socially isolated, with not many options in terms of career progression. Schooling for children and partner opportunities were rated within a point of each other. And still fairly high, but just shy of 70, was lack of access to healthcare. For very remote, topping the charts and just under 80 was schooling for children. MM7 had fewer purples and 4 more yellows than MM6. Of the 8 means above 70 and after schooling for children was heavy workload and burnout, followed by lack of suitable accommodation, which aptly represents current issues faced by very remote communities. Rated lowest was job security, and in amongst the lowest were also lack of generalist skills and the lack of opportunity to use existing skills. To be honest, we did expect these to be slightly higher because we know that the remote workforce is relatively young. And we also hear time and again that many nurses report frustration at not being able to use their full skill set. Of the workplace factors for the state, there were only 2 means above 70, workforce shortages and financial incentives and rewards, which probably feeds into the highest rated heavy workload and burnout individual factor seen earlier. The next 3 highest factors were workplace culture, workplace flexibility, and the lack of locum replacements. For remote locations, again, lots of purple. 9 had means above 70, and the rest were in the 60s, and only 1 barely making it below 60. Accommodation difficulties was ranked 3 spots higher than the state ranking. The next 2 I feel are quite telling, workplace culture and flexibility, as these could definitely be addressed, especially with workplace culture. Following this was operational management and factors related to career progression and support. Once again, fewer purples in MM7 than MM6, with workforce shortages again being the highest rated factor. Accommodation difficulties were again rated quite high, followed by lack of locum replacement, workplace culture, and operational management that made the top 5. The next few were around career progression and the lack of community facilities, including healthcare in the region. Financial incentives, physical infrastructure, and scope of practice were perceived to not be that important. Now, we have seen all of these before, but we thought it would be interesting to see what the top 10 were when both individual and workplace factors were combined. This is for the state, and we have 4 related factors in the top 5: heavy workload, shortages, work-life balance, and mental health and well-being. Then you also have the 6th and 7th factors as a cluster around inadequate pay, both as an individual and workplace factor. Workplace culture made it to the 9th spot. In the next slide, we'll unpack and compare these top 10 statewide factors to that of remote and very remote locations. Highlighted in yellow are all the remote top 10 factors that were also in the statewide top 10, and the red highlights are the statewide factors that were not listed in MM6. We've also got the statewide rankings in brackets. All MM6 means was 70 or higher, with one above 80. And 8 of the top 10 were also in the statewide top 10, but were rated lower. Ranked third in MM6 was professional isolation, which was ranked 10th in the state. Other unique factors were schooling for children, ranked 11th in the state, and accommodation difficulties, ranked 15th in the state. For MM7, again, all means was 70 or higher, and there were 6 new factors in their top 10. After workforce shortages was schooling for children, and the 4th and 6th highest rated factors were both about accommodation issues, which were ranked 15th and 20th in the state. I think it's safe to say that with varying remoteness, perceptions of why staff leave differs. We also asked participants if they felt we had missed any important factors and gave them the opportunity to comment. We received about 120 comments from all of Queensland, and nothing new was mentioned. We did, however, conduct a thematic analysis. A lot of them mentioned workplace culture as a factor. Others mentioned that there weren't enough community and lifestyle amenities available to retain staff. Only 24 responses mentioned remuneration and costs, and by costs, they primarily referred to the additional costs to live in a remote or rural location. And the final theme circled back to workload and burnout. So bringing it all together, staff shortages and heavy workload and burnout were consistently thought to be major factors to staff departures. Unique to remote and very remote communities were highly voiced needs around schooling for children, partner opportunities, and suitable accommodation. Other major factors related to these were work-life balance and mental health and well-being. Career progression was another one. Financial factors were important, but not the most important. Workplace bullying was ranked lowest, and use of existing skill sets or the need to develop further skills was not seen as an important contributor to departures. And lastly, but most importantly, geography matters. So the question is, where do we start? Where do managers or workforce planners start? Shortages in workload appears a universal aspect. Can anything be done to restructure employment? Is there anything currently being done to increase partner employment opportunities or improve accommodation options? The flavor of the month seems to be collaboration, and to get runs on the board, it seems like we would have to consult with the existing workforce, existing services, and even the whole region, and let them help identify what the most important factors are and which strategies may be most successful. What our results suggest, and there is overlap, is that in remote MM6 communities, perhaps support professional growth through increased access to CPD, and a mentor buddy system to combat professional isolation, internet upgrades to possibly enable partners to work remotely, and improve accommodation options. In very remote MM7 communities, and here's the overlap, drive opportunities for partner employments, improve accommodation options, working with councils or government, and develop a pool of locums to improve leave coverage for staff. And that's it from us at Health Workforce Queensland. Thank you for listening, for your time, and for your passion for remote and rural health. Thank you.